Hey everyone, welcome back for another deep dive with us. I gotta be honest, the phrase drug allergy always kind of makes me wince a little bit. It's not exactly a walk in the park, right? And the thing is, it's way more common than people might think. It's not just a mild thing either. We're talking about serious stuff, the kind of thing that can land you in the ER. So to help us unpack all of this, we have an expert in all things allergies joining us today.
Thanks for having me. It's great to be here. It's interesting because people toss around the word allergy so casually these days. But when it comes to drug allergies, it's a whole different ballgame. You know what I mean? We're talking about your immune
Yeah.
system, your body's defense system, basically mistaking a medication for something dangerous. And when that happens, things can get, well, let's just say it can get a little hairy.
Okay, so before we get into all the scary stuff, can we break down exactly what a drug allergy is? Like, how is that different from, say, having a bad reaction to some food I ate?
Absolutely. Yeah, that's a great question. So, with a drug allergy, your immune system is basically going into overdrive. It releases all these chemicals, like histamines, that are supposed to fight off invaders. But in this case, the invader is actually the medication you took.
So it's like your body's security system going haywire, setting off all the alarms for someone who's actually supposed to be there.
You got it. That's a great way to put it. And all those alarms, those are the symptoms you're experiencing: hives, rashes, itching. It's your body trying to tell you something's wrong.
So what I'm hearing is any medication, even something you've taken before with no problem, could potentially cause an allergy.
You hit the nail on the head. That's exactly right. And that's what makes drug allergies so tricky, because they can pop up at any point in your life. You could have taken something 100 times before, and then suddenly, bam, your body decides it's had enough.
Wow, so I can't even rely on my own history with a medication.
Yeah.
There's always a chance my body could just say, nope, not today.
You got it. And here's the thing. It's like our bodies have a weird sense of humor, right? The first reaction might be super mild, like a little rash. And you might think, that's weird, but it's no big deal. But then the next time you take it, bam, your body goes into full-blown panic mode. And with each exposure, the reaction can get worse. I actually read a study where this patient had a mild rash the first time they took this antibiotic, but then a few months later, they took it again, and they went into anaphylactic shock, which is incredibly dangerous. So it really shows you how unpredictable and potentially serious this can be.
Anaphylactic shock, yeah, that's a term that definitely makes my heart skip a beat.
Yeah.
Can you explain what that is exactly and how it's connected to drug allergies?
Yeah. Sure. So anaphylaxis is basically like the most intense, most severe allergic reaction you can have. And yeah, it can be life-threatening, absolutely. Imagine your throat starts to close up, your chest tightens, and you can't breathe. You might feel dizzy, lightheaded, your heart's racing. Your body's basically freaking out because it sees this medication as a major, major threat.
Okay, so we're not talking about just toughing it out with a headache here. This is the real deal. I'm guessing this is a call 911 immediately situation.
Absolutely. You got it 100%. With anaphylaxis, every second counts. You don't wait to see if it passes. You don't try to tough it out. You call for help right away.
That's intense.
It is. It definitely can be. But like they say, knowledge is power, right?
That's what we're here for. So let's say, hypothetically, I know I have a drug allergy. What are the most important things I need to do to stay safe? Like, what's my game plan?
Well, first of all, you're already ahead of the game by simply being aware, so that's huge. But the most crucial thing, hands down, is knowing exactly what you're allergic to.
So like knowing the name of the medication.
Yes, but I mean really, really specific, not just, oh, I'm allergic to penicillin. You need to know the exact name, both the brand name and the generic name.
Wait, so even if I'm careful about reading the label on the bottle, I need to know the actual drug name too.
You got it, 100%. Because you see, sometimes the same medication can be sold under different brand names, or sometimes a generic version might have slightly different ingredients, and those tiny differences could still trigger a reaction.
Okay, I think I'm getting a headache just thinking about all these different names.
Yeah, it's a lot to keep track of.
But I get it's like double-checking your escape route, just in case.
Exactly. And once you have all that down, think of yourself as, a town crier. Spread the word, tell your family, your friends, anyone who might be with you in an emergency.
So it's like a superhero origin story, but instead of superpowers, I'm sharing my allergy info.
I love that. That's a perfect way to put it. And don't forget about your healthcare providers. They're like your superhero team. Every doctor, every nurse, pharmacists, dentists, everyone, make sure they know about your allergy.
Oh, right, dentists. I wouldn't have thought about that.
Oh, yeah, they use medications too, all sorts of stuff.
So it's all about being our own best advocate here.
Exactly. You are the expert on your own body, right? Nobody else is living in it 24/7.
That's true. Now, I've seen those medical ID bracelets. Are those actually helpful or more just for peace of mind, do you think?
Oh, those things are lifesavers, I'm telling you. Especially if you're ever in a situation where you can't communicate, like if you're having a severe reaction, that bracelet is like a big flashing sign that tells first responders exactly what's going on, even if you can't.
It's like a mini billboard on your wrist.
Exactly.
Okay, so we've got knowing our triggers, we've got assembling our allergy A-team. What else is there to this whole managing a drug allergy thing?
Well, this next part is where things can get a little tricky. We have to talk about indirect exposure.
Indirect exposure. Okay, now that's a term I haven't heard before.
Yeah, it's not something people always think about.
It sounds kind of ominous, like I could accidentally teleport into an allergic reaction or something.
Well, it's not quite teleportation, but I get what you mean. Basically, it means you could have a reaction without actually directly taking the medication yourself.
Wait, hold on a second. How is that even possible? Do medications have, like, allergy fumes now or something?
It's not fumes exactly, but more like microscopic remnants. Tiny, tiny traces of medication can linger on surfaces, in the air, even on other people.
Seriously. Give me an example. I need to wrap my head around this.
Okay. Imagine someone in your house uses a lotion that you're allergic to. Seems harmless, right? But even tiny, tiny amounts of that medication can actually be present in their sweat. And if you have close contact with them, that can be enough to trigger a reaction in you.
No.
Oh, yeah. Or let's say you're at a restaurant and the chef uses the same cutting board to prep your food after using it for something you're allergic to. Cross-contamination is a real thing, and it can happen anywhere.
Wow, I had no idea that was even a thing. It's like a hidden danger zone, but instead of sharks, it's microscopic medication particles.
You got it. And that's why being open and communicating with the people around you is so, so important. Talk to your family, your friends, explain the situation, see if there are ways you can minimize the risk together, like maybe designate a medication-free zone in your home, or be extra cautious about food prep.
Yeah, that makes a lot of sense.
It takes a little bit of effort, but it's so worth it.
So it sounds like living with a drug allergy requires, like, a certain level of vigilance, you know?
Yeah.
You have to be constantly aware of your surroundings, what you might be exposed to.
It's true. It does require a bit of detective work.
I like that allergy detective work.
But don't let it stress you out. Remember, knowledge, preparation, communication, those are your best defenses. And your healthcare providers are your allies in this. Don't ever hesitate to ask questions, voice your concerns, seek out additional support.
Okay, that is definitely reassuring to hear. But what about those situations where you don't even know if a medication is safe? Like if it's something you've never taken before, is there anything proactive you can do? Like some kind of allergy detective work? Continue with that analogy. Allergy detective work. I like the sound of that. What kind of tools are we working with in this detective kit of ours?
Well, you're already on the right track by thinking proactively. Allergy testing is a really valuable tool when it comes to this stuff. It's like shining a light on those hidden sensitivities, you know? It helps you get a clearer picture of what your body's reacting to.
Okay, so break it down for me like I'm 5 years old.
Yeah.
What actually happens during allergy testing, and how does it help someone with a drug allergy specifically?
Okay, so picture this. You're at the doctor's office, and they take a tiny, tiny amount of the suspected allergen, like, say, penicillin, and they expose a small area of your skin to it. It's a super controlled environment, and they watch you very carefully for any reaction.
So they're basically doing a mini test on your skin to see if any alarm bells go off.
Exactly. And those alarm bells could be anything from a little bit of redness or itching to, in rarer cases, a more serious reaction. But don't worry, medical professionals are trained to handle any situation, and they've got all the safety protocols in place.
Okay, that makes me feel better. But let's say I do have a reaction to the test. What happens then? What does that tell me, and how does that information help me avoid problems in the future?
Another great question. So first and foremost, it confirms that you do indeed have an allergy, and it helps pinpoint the specific culprits. But here's where it gets even cooler. Allergy testing can also reveal potential cross-reactions, like those people you may know suggestions on social media, but for medication.
Okay, now you've got my attention. Cross-reactions, people you may know for medications. Tell me more. I'm hooked.
All right, so let's stick with the penicillin example, since it's one of the most common drug allergies out there. There are other antibiotics out there that have a similar chemical structure to penicillin, kind of like distant relatives.
Okay, I'm following you. Like they're part of the same family.
Precisely. And here's the thing. Because of that family resemblance, your body might mistake one of those other antibiotics for penicillin. And even though you've never taken that specific medication before, your body might say, nope, I don't trust this guy, and launch an immune response.
Whoa, that's crazy. It's like your immune system has a one-track mind and jumps to conclusions.
You got it. And that's where allergy testing comes in clutch. It can help identify those potential cross-reactions so you can steer clear of those medications altogether. It's like having a VIP pass to avoid all the drama with those problematic relatives.
That is so wild. It's like allergy testing gives us this secret weapon in the whole drug allergy battle.
It really is. And the more you know, the better equipped you are to advocate for yourself. So don't be afraid to talk to your doctor about allergy testing, especially if you've got a history of allergies or you've had a reaction in the past.
I love how you keep emphasizing self-advocacy. Because it's true. Knowledge is power, and knowing what questions to ask is huge.
Absolutely. You are your own best health advocate, no doubt about it. Never underestimate the power of being informed and speaking up for yourself.
This has been such an eye-opening conversation, honestly. We've gone over so much today, from really understanding what drug allergies are and how to spot those red flags, to all the proactive steps you can take.
It's been a pleasure, really.
So as we wrap things up here, if you could leave our listeners with just one golden nugget of advice, what would it be?
Don't be afraid to be your own health detective. Ask questions, do your research, and remember, you have the power to live a healthy, fulfilling life, even with a drug allergy.
I love that. Be your own health detective. That's going on a t-shirt for sure. And on that note, we'll leave you with this thought. Now that you have a deeper understanding of drug allergies, what's one small step you can take today to feel more in control of your health? Until next time, stay curious, stay informed, and stay healthy.